Okay, there's been some confusion recently about who exactly can receive federal Medicaid benefits in the United States. And the confusion is very intentionally coming from the top of the Republican Party, with Donald Trump saying that the big, beautiful bill, so-called, will kick, quote, millions of illegal aliens off of Medicaid to protect it for those who are the ones in real need. Republicans are repeating this bit of misinformation over and over. We are throwing illegal immigrants off of Medicaid, and they are particularly using the number 1.4 million over and over. So what they're saying is factually false, and it's easy to show that. But before we do that, let's talk about what exactly Medicaid is. It's a joint federal-state program that provides health coverage for low-income individuals, but also families. And Medicaid is funded by both federal and state tax dollars. Here's the key fact. People living in the United States illegally are not eligible to receive regular Medicaid benefits. And they don't. Like, period, full stop. The only exception is emergency medical services, things like emergency room visits or emergency labor and delivery. According to health policy experts, less than 1% of all Medicaid spending goes to emergency care for non-citizen immigrants. 0.4%. So where does the confusion or misinformation come from? Well, some states use their own state tax money, not federal Medicaid dollars, to provide health coverage for immigrants regardless of status. They have decided as a state that that is a value they think is important. This is called state-funded health insurance, and by definition, it's not Medicaid. So what's going on when we hear politicians like Trump and other Republicans say that their bill will kick millions of illegal aliens off of Medicaid? What this bill would do is penalize states who use their own funding to give health insurance to undocumented people. The CBO analyzed that part of the bill and said that that part would result in 1.4 million more people, some of whom would be undocumented, losing their health insurance because they would be losing state-funded health insurance that the states could no longer afford to pay for. The bottom line is that this is false. And this is too. Federal law has never allowed comprehensive Medicaid coverage for undocumented people. And again, the only exception, less than 1% of the time, emergency services. So just be aware when Republicans talk about removing immigrants from Medicaid, they're generally actually referring to state-funded programs that the federal government has nothing to do with. Well, facts still matter, truth matters, and understanding these distinctions enables us to have an actual conversation about healthcare policy and immigration. Thanks for listening and for sharing this information, because people like the truth.